National Union of Nurses has called off their strike after reaching an agreement with the national and county governments. The nurses had downed their tools, demanding for harmonization of allowances and the recognition of the union as the sole voice of nurses at the counties.
It's a sigh of relief for both the government and patients across Kenya, following the nurses' decision to call off their industrial action, one that had crippled services across various public hospitals for close to 2 weeks.
I want now, with the powers conferred to me by the National Governing Council of Kenya National Union of Nurses, the National Executive Council of Kenya National Union of Nurses, to officially declare the strike for the Kenya National Union of Nurses that started on 5th December 2016 officially suspended.
It was marked by the signing of a recognition agreement involving the chair and the secretary general of the union and all the 47 governors. This means the nurses will no longer have the freedom to call for a strike without following due procedure.
The recognition agreement is going to structure our labor relations and in the way that we operate going forward, because as county governors, we are all committed to ensuring that health services in this country are the best that should be.
Whenever we go on strike, we will not close newborn unit. The children who are in newborn unit will continue to get medical attention on the nursing care. The ICU, our patients who are in ICU will continue to get nursing care. Maternity, those who are in labor, they will continue to get nursing care until they give birth. The only thing that we will not be doing is to admit patients.
Earlier on, the union officials had walked out of the negotiations, saying they were being pressurized into calling off the industrial action, yet they were not assured of the deal, but later returned to the negotiation table.
This is not a joke. You cannot get people out there and our people have died. And then they want to give us cosmetic. They want to tell us that we call off the strike, then we sign the recognition agreement. Suppose we call off the strike, then they refuse to sign the recognition agreement. What do? They have the mandate, they have the powers to do that. They have treated us like that before. They have treated us for the last 3 years. We do not trust them.
The end of the nurses' strike comes at a time when consultants from the Kenyatta National Hospital have also announced withdrawal of their services from the biggest referral hospital in the country.
We, the consultants, hereby withdraw all services, including emergency services rendered at Kenyatta National Hospital, both at public and private wings, inpatient and outpatient, with immediate effect.
Following the court ruling terming the doctors' strike illegal, Health Cabinet Secretary Cleopa Mailu and the chairman of the Council of Governors, Peter Munya, have urged the doctors to obey the court system and call off the strike.
Interests of the general public are as important as the interests of the individual. The rights of the suffering public of Kenya is equally important. So even as we look into their grievances, we need to appreciate the larger interest of the general public that is not accessing medical care at this particular point.
I won't forget to urge the doctors who are on strike, as I said earlier, to come back to the negotiating table.
The recognition agreement with the nurses will form part of the comprehensive harmonized CBA, whose talks will begin on the 1st of January 2017. The signing of the recognition agreement brings a ray of hope to patients across the country that services will return to normalcy. But it's not until the doctors return to the negotiating table and also reach an agreement. Caroline B, KTN News.